The future is also looking bright for patients battling with irregular heartbeats. A brand new device is revolutionizing the treatment of this sometimes fatal condition. DMC Sinai-Grace was the first healthcare facility in Michigan to successfully resynchronize a patient's heartbeat using a breakthrough pacemaking device. The new Unified Quadra pacemaker is the smallest pacemaking device and the only 4-electrode pacing system available. I sat down with Dr. Siddiqui, Sinai-Grace's chief of cardiology, who performed the surgery, to learn more about this new medical breakthrough.
A pacemaker is a small device that was invented, at least 30, 40 years ago. This is to treat patients who have slow heart rates. The slow heart rates either can be related to the patient's own pacemaker failing or as a result of conduction abnormalities in which the electrical conduction is not flowing properly from top to bottom portion of the heart. So those are the conditions in which a pacemaker is very helpful. A biventricular defibrillator is a super device. It acts as a pacemaker, it acts as a defibrillator, it acts as a heart failure device. As you know, there are about 5 million patients in this country with heart failure. And out of those 5 million, at least there are 1 million patients that need a biventricular defibrillator. So in a biventricular defibrillator, you try to resynchronize the right lower and the left lower portion of the heart. These are the right ventricle and the left ventricle. So we put the leads into the right ventricle and the right atrium the traditional way. In addition to that, through this vein of the heart called as the coronary sinus, we place a lead going onto the top of the left ventricle so that these two act together in synchrony again. Okay? That way you can get the blood out in a fashion in which it was designed to. So that really helps in resynchronization of the heart. In experienced hands, it's a very easy surgery to perform. At Sinai-Grace, we have been offering this surgery since 2004. We had remarkable success. And what this lead adds to the procedure is versatility. We had only one chance of doing surgery on this patient. We wanted him to have the best options as far as stimulating the left side goes. We had a remarkable outcome in this patient, actually. He went from being on dobutamine to not being on dobutamine within 24 hours, and he was discharged home within 36 hours after the procedure. It does make a huge difference in patient's life, okay? There are a lot of times in which patients that were referred for a biventricular defibrillator, they were on hospice care or they were on transplant list, and we were able to take them out of this hospice and transplant list. And a number of patients have, gone on and lived a fruitful life for the next 5 to 7 years, if not longer. It's better to offer a lot of new procedures for, our patients over here, so it's very exciting.
The Unified Quadra pacemaking device is the latest addition to a comprehensive heart health program here at Sinai-Grace. If you would like to make an appointment with a Sinai-Grace heart specialist, call 313-966-4800. I'm Tina Taylor for Sinai-Grace Today.